You're listening to the Sick and Good podcast. My name is Dustin Messick, RDN. I'm a cancer survivor.
My name is Dr. Colin Goodwin, and I'm a cancer survivor. We're discussing topics related to cancer treatment and recovery while promoting wellness.
To find a balance between sick and good.
That during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regimen.
Well, I'm pleased to welcome back to the conversation Dr. Rhonda Sherman. To remind the listeners, Dr. Rhonda Sherman is a licensed psychologist in California and Texas who specializes in the area of psycho-oncology. And joining us today is actually one of her clients, Jennifer. And Jennifer is a breast cancer survivor. She was diagnosed with stage 2B invasive ductal carcinoma following a mammogram. So I wanted to welcome both of you to the podcast.
Good to be here again.
Thank you.
So, Jennifer, can you tell us about your diagnosis and treatment and your current cancer status?
Sure. So I was diagnosed at 41 with stage 2B actually. So was there for a routine mammogram, and it was already metastasized to my lymph nodes. So after following chemo, radiation, reconstructive surgery, I'm glad to say that I have been in remission or cancer-free for the last 5 years. So currently doing well.
Wow, congratulations on that. I'm curious, when it spread to the lymph nodes, what does that mean for somebody who's already got breast cancer?
Well, it's a little bit more, I guess, invasive or aggressive, as oncologists would say. So it's already left the site, the breast, and therefore could have spread in the lymphatic system through the lymph nodes and to just distant organs and stuff like that. So being that it had spread, even though the cancer was slow growing, they still had to run all the scans. So CT scan, bone scan, all of that, just to make sure it had not spread any further than the lymph nodes.
Did you have any lymph nodes removed? Did you have a lymphectomy? I think that's called. I might have mispronounced there.
Yes, I did. Lymph dissection, they called it, I guess. I had actually 25 lymph nodes removed out of the right side of my arm, under the armpit, and then one removed on the left side where there was nothing found. And the results from that pathology was just one lymph node involvement. So I was lucky, yet they treated it very aggressively just to make sure.
Well, I'm very interested to hear how you were able to get in contact with Dr. Sherman and how you were able to identify your need for therapy. Perhaps maybe you can discuss just what brought you into therapy and that referral process.
Sure. In one of my visits to my medical oncologist, I spoke with a nurse navigator, and that person kind of coordinated efforts just with all the team of doctors. And she also just provided some resources, and one of which was a psychologist just for my mental health. And I think my husband and I both looked at each other like that was top of the list. Like we had to get that done and look into that a little bit further. I will say I was a complete wreck, complete mess. I had 2 young kids, 9 and 11, career, just my whole life basically ahead of me. So it just really stopped me dead in my tracks, I guess, and had never had anything big like this traumatic experience in my life before. So I needed some help. I needed to speak to someone that wasn't a friend, wasn't family, just a professional to help me. And Dr. Sherman was actually one of the people that they had given to me to look into. And I think when I started the research on her, I forget how I found out, but most of her practice was breast cancer. And so I was like, done. And she's a woman and felt like she could understand, from the female side of things and body image, all the woman type stuff. So I was really lucky to land with her and get just really like her from day one. She's was no nonsense and just started digging right in and just felt very comfortable with her. So I didn't have to shop around, if you will. And we're still together after all this time. So
I wonder, Jennifer, if you could, when you say you were a mess, I mean, you kind of described, you had kids, you had jobs, but are you able to talk about what you were feeling and thinking that was causing you psychic discomfort that you and your husband felt, seeing a psychologist would help you with?
Sure. Just to be pretty blunt about it, I was scared of dying. Like I thought with a breast cancer diagnosis, or the C word as they call it, any cancer, that was a death sentence. That was the way I looked at it from day one. I know it doesn't sound rational, but when someone tells you that, it's like your life flashes before your eyes. And I think everybody handles that differently. But in my perspective, it brought me over the edge where major anxiety. Like I couldn't even think straight. I couldn't go to appointments. Luckily, my husband went to every appointment, still does, but he just started taking notes and just getting it all together and had a pink binder and backpack, and I couldn't even see straight. So I couldn't fill out the forms. I was just, when I say just in another world, I really was. I just could not focus on anything. And every time I turned around, I thought, okay, this is it. Like, how many more days do I have left? That's just where my mind went. So I needed some help. I couldn't function through my daily life, being a wife, a mom, employee. I couldn't do that in the state I was in. And both my husband and I knew that pretty much initially. Because initially, when I was diagnosed, I made my husband drive me to the HEB parking lot close to my house because I couldn't even go home. Couldn't even face my kids. I couldn't face my mother. I didn't know what to do. So that's, I guess, I was just a mess. I couldn't quit crying, all of that stuff. So it was bad.
And so, I just want to kind of comment on that's a reaction, a severe reaction, not uncommon, but severe reaction to receiving a cancer diagnosis for many people, because you're going along in your life and you were fit and healthy. You weren't a smoker or a drinker. I mean, none of that. Mm-hmm. And then you're told you have an illness that you could die from. And it's so, how the psyche it takes a while to grasp and understand what it means, because it doesn't make sense, because you're this healthy person and you don't feel sick, you don't feel bad, you don't feel tired, and it's very traumatic to hear for the psyche. And so what I heard is your brain just couldn't make sense of it at all. And then the anxiety is response to a threat. And the threat was you're going to die, or the threat is uncertainty. The threat is the unknown of what the future is going to bring. Treatment, unknown. If you do treatment, side effects, will you survive? What about work? What about income? I have 2 kids. I need to parent. What about my marital life, my sex life? My physical body changes, all of that. And I think for you, it was just way overwhelming. You weren't functioning because you were emotionally overwhelmed with it.
Correct.
Glad you came.
Me too.
I almost had this visual of like the spinning plates. Yeah. Rhonda had mentioned just all these things that come up and all these thoughts that come up with the diagnosis, and having all these things be overwhelming. And I think I just wanted to comment on that as well. It's like, that's pretty common experience, having that reaction.
Yes.
But it did sound like there was more of a severe reaction where you weren't able to then function in the ways that you would like to have, or in the roles, being a mother and so on. I'm really interested to hear how you've benefited from psychotherapy.
Wow, that's a big question because I think my whole life changed. And when I say that, I mean, initially I was there for the breast cancer shock, having cancer and how to deal with those feelings. And one of the biggest words that came from Dr. Sherman was just to accept this, accept where I am. And this is my story. And if you don't accept it, you're going to keep fighting it. And that was big. So once I got past that, I was a little better. I started taking more of things in stride rather than just fearing the unknown so much because I knew it wasn't going away. That was the big thing. I knew that even through treatment, even through being told it's gone, all that stuff, that whole shock of cancer and what it did to my life carries on. So I benefited from accepting this is my life and just ongoing. There are times that we've stopped or I've stopped therapy for a brief time and then have had to come back for other things. And when I think about it, it's really a lot related to the cancer, different areas of my life that I struggle with. But I'm handling all of that so much better, different things that are coming into my life or different things that are happening, whether it's my aging parents or my 2 teenage boys, my marriage, all of that stuff. I'm handling those things better and learning how to cope with Dr. Sherman's help as well. Just, I would say our sessions now are not as intense. They're just more tweaking here and there, which is good, good that I'm to that point. I think initially it was just really a struggle. Couldn't quit crying. My phone would ring. I'd freak out, thinking it was the doctor, things like that. So it has benefited me in so many areas of my life. I now recommend to everybody that they should be in therapy, whether they have cancer or not. I think should be required for everybody to stay normal.
I do want to add that prior to the cancer diagnosis, I think Jennifer probably had some type of anxiety disorder. And so maybe that was part of the severity of her reaction. And what I find is that whatever an individual is struggling with in their life or has a tendency towards psychologically, emotionally, or if there's relationship issues or family issues, with a cancer diagnosis, those all have a tendency to get worse. So I'll see patients who have a history of depression, and their presentation to my office may look very different than Jennifer's presentation because of their history of depression. If a person has a history of, let's say, sexual trauma, and the diagnosis is breast cancer, they may be re-traumatized or have a set of issues because of their history of their trauma. So we're not just treating how does a person respond to cancer, but a human being has a history and a past and some brokenness or issues. And that plays a role into the presentation.
Hearing this acceptance piece, that was such a big part of your journey so far, Jennifer. I'd like to hear more about that, like how you got there. And second part of my question is also maybe some of the different modalities that you did working with Dr. Rhonda Sherman. Was it just talk therapy, or was there any like specific things that you found to be the most beneficial working with them?
Sure. As far as acceptance, I think that I don't know. I always thought when I saw Dr. Sherman or we had an appointment or we were talking, she was very, to me, and it was good for me, it was very direct, meaning, okay, you have cancer. That's not going away. There was no sugarcoating that this is a great deal or trying to make this better. It is what it is. It's horrible. I'm sorry that you have this, but we got to figure out a way for you to live to live and to cope through life and be prepared, because there are going to be other things in your life that may come up. You may lose a spouse, you may lose a kid, things like that. And I started to think, yeah, I have to be prepared, not only with this, but anything else in my life that were to come up. I think prior to the cancer, I was floating around through life thinking, I'm going to make it till 90. I work out all the time. I eat well, do all this stuff, work, went to college, got a good job. Things are great. And then bam, it's like big reality check. So I had to start looking at all the things that it taught me, meaning perspective. So I just started looking at things a different way. And I did truly, at some point, it was like a trigger, a light switch. Like I realized I have to accept this diagnosis and make the most of it, pay it forward, help somebody else that I can do. And that's what I did. I started volunteering. And that too gave me more gratification and more healing, just to tell my story to other people who were going through similar things. So I think it just has to click. Like it has to click with that person. Are you going to live in a hole and never come out and fear everything constantly? Or are you just going to take it and run with it and run with your new body? I always tease, kind of joke around saying I have this, my body is put back together. I had a major reconstruction surgery and a lot of complications, or several complications. So it's all put back together. And this is the new me. So I think that I just really had to take things a different way. But I did have good support. My husband has helped me through a lot. So I can't go without crediting him for some of this. He's extremely positive. So that did help me. So through therapy, he's met Dr. Sherman, I guess, a couple times, but he's always excited when I have it on the calendar because he thinks it's so good. He says, you're always better after you see her. I know. So I don't know if that answered your questions, but
that definitely answered acceptance. And like, as far as like working with Dr. Rhonda Sherman, is there anything in particular in your sessions? Like, do you feel like it's all talk therapy and just talking is enough to kind of heal? Or is there maybe different techniques that they use with you that you feel like has really worked with you?
I remember one session, one was big. And I tell this to people. When I was so scared of dying, one of the things she told me was, okay, let's pretend you're dying. And I was like, what? And she says, what's going to happen? You're basically everything goes black. You pass away. You don't know what other people are grieving. Yes, they're going to grieve. Life's going to go on. And I guess it's just putting that into perspective, meaning the reality of things, the reality of death, which was a big fear. And that was one of the initial things I had to overcome. It was huge. Secondly is life is not perfect and you will have more trouble. You will have things that come up and you're not going to know when it's coming. So you can't live this. I couldn't live a life where I had just a bulletproof vest that nothing would ever happen again. So a lot of that conversation, just giving me certain things to think about, more like realistic things. Because I think, like I said, I was in this little bubble thinking my life's great. Nothing's going to happen. Everything's going along fine. So again, like Dr. Sherman said, everybody comes with a different situation. Mine was anxiety, clearly. I've had a lot of anxiety all my life, never diagnosed. But when I look back on it, I was constantly worried about something happening, going for my mammogram, being told I had cancer. Well, guess what? That happened. And I think that was an appointment I had with her too. And even now, like going to any doctor, I'm like, go to my dermatologist. And I'm thinking, okay, well, if she's got to biopsy something, I have to actually think through that. And that was something Dr. Sherman told me. Okay, if she finds something, they're worried about it, we just got to deal with it. it has to go off for a biopsy. Then you'll know. Hopefully it's caught early, just like the breast cancer, and you go on. So I guess just talking through things more to myself and the reality of the unknown. Like if it does happen, I mean, I can't prevent it from happening anyway. So, but I have come a long way. I can say those words now, but back then I'm like, you're crazy. I could never think that way. But it didn't, I don't think, unless you disagree, Dr. Sherman, I don't think it took that long for me, but maybe it did. I had other things come up in the whole process, but that initial thing didn't take too many sessions, I don't think.
Yeah, so we did individual therapy for about a year, and about 8 months, 7, 8 months into it, and we didn't necessarily meet every week, you started making a lot of progress about acceptance. And Dustin, you keep on, you're asking great questions, so let me see if I could kind of answer them more specifically about techniques and interventions. There are many of them, and I try to give clients a toolbox, different types and modalities of helpful things, because you just never know what's going to speak to one person is different than the other. The issue regarding fear of death and dying can be complex, and I'm very open and encourage, if the client wants to talk about it, to really dive in reality about death and what is death and what does it mean to them and what exactly are their fears about, and the reality of when someone's body dies, you don't know that you have died. And so the suffering isn't there. It's the anticipation of thinking about it, because this life is all that we know. And it's very scary to think about not being in this life, existing like this. So there's conversations like that. There's conversations from the existential kind of approach of why are we even here? And sometimes meaning making therapy. What do we want out of this life? What brings us meaning? And let's focus on that. Let's not focus on you may or may not be here in 5 years, but let's focus on the present and the past of what brings meaning and how can we continue to create it. The concept of mindfulness comes up a lot because all we have is the present, and we need to be in the present, and we need to accept the present as it is and not judge that what we're experiencing right now should or shouldn't be, or is good or is bad. That's my interpretation of mindfulness, that you stay in the present moment without judgment. And that's acceptance, that you accept it without thinking it should or shouldn't be here. There is the traditional cognitive therapy approach. And I think with Jennifer, this was helpful. Jennifer has a tendency to think about the future outcomes in her life, but in a negative way. I think that something may happen and it's going to be negative. She wasn't thinking about the future in a positive way. And not that I ever told her to think positively about the future. In fact, I never tell anybody to think positively about the future because I don't know what the future is. A client of mine might die in a month. I don't know. But so to help them identify catastrophic thinking, which are a lot of what ifs. What if the treatment doesn't work? What if I go in for this biopsy and it's cancer, like Jennifer was saying? So those are some of the specific techniques and interventions. Is that kind of what you were asking?
Yes, that was a really good answer, Dr. Sherman. So I have one more follow-up question for Jennifer, but you definitely had kind of closed the gap there on just like what I was curious about. Sounds like maybe, was there any like reframing that you ever had to do with Jennifer? Just like I've heard in like cognitive behavioral therapy, they like teach like reframing to patients.
Reframe. I reframe a lot in my work in general. In terms of Jennifer, so Jennifer, like a lot of my clients that are breast cancer patients and survivors, are very educated, bright, driven, capable, independent women. And so for those types of individuals, I think and Jennifer, I'd like to hear your opinion, but this, like Jennifer said, the straightforward, rational thinking discussion is helpful. And I'd like to hear Jennifer's opinion, but that also speaks to Jennifer encouraged me as a client to form a group of women that I just described to come together as a group and facilitate group therapy and group discussions. And I think that was also beneficial, and Jennifer could talk about that too in terms of a different modality. So individual we did, and we did group.
Okay. Jennifer, are you going to talk about that now?
Sure. Yeah, like she said, I think in our sessions, we'd have conversations like, or she'd mention a client has this struggle sometimes, or same struggles. And I was like, maybe we should kind of do a group therapy session, and just kind of see, because sometimes you can benefit from hearing other people's perspectives. Because I searched out for group counseling or support groups initially, and I went to a couple, none of which I'd walk in the room and everybody's 20 years older than me or more. And I wanted to meet women because I didn't know that were going through some of the same things, small kids, career, they were working, marriages, things like that I couldn't associate with in the bigger support group setting. So yes, we did that. I think it was very good. I actually learned some things. I felt like I could share some of my things that I was going through that helped them. So I really enjoyed that. I think that should be for breast cancer. I would think that would be something that therapists could really use with their clients that would be helpful. Because it's one thing to talk to your therapist or, like I said, a family or a friend, but when someone's actually going through cancer or treatments and things like that, it's a different talk and a different understanding that you can kind of share experiences with and know you're not alone. Like, know that the person next to you is going through something very similar. And also found that in my volunteer work that I do, we would get in conversations about sharing some of the same experiences. So it helped people, and it helped them to know you're not in this alone. There's a whole world out there that's going through similar things, and they're doing fine and coping with it and things like that. So I think that was helpful.
And we did that group for 15 months pretty regularly.
Mm-hmm.
So, and they were all individual clients of mine that I felt were very similar, that could help each other. They all worked, they all had careers. There was, a physician, there was a flight attendant, there was a VP of finance at a big oil and gas company. And I think they all, because I knew their personalities were very similar, it was very, very helpful to talk to other women going through the same thing. And at that point, Jennifer had worked through a lot of her anxiety and coping with a lot of aspects of cancer. And I viewed you, Jennifer, as probably helping the group more,
Mm-hmm.
which benefited you, but you weren't coming in with high levels of distress like maybe some of the other women were, and you were able to help them,
Mm-hmm.
which helped you.
Absolutely. Yeah.
Mm-hmm.
There's definitely phases, I think, and everybody goes through phases of, I would say, grief and in a cancer diagnosis. Some stay in certain areas longer, and there's nothing wrong with that. But if I can help somebody, and whenever I have someone say, oh my gosh, just listening to you has helped me, that's big. I'm like, maybe that's what I'm supposed to be doing, and helping others know that it's not the end of the world. I've come a long way, though. I couldn't say that on day one for sure.
Yeah. Can you talk a little bit about so you had hormone receptor positive breast cancer, and I know it's a lot of talk out there for breast cancer patients about taking medications post-treatment for cancer prevention that suppress hormones. And I think that's a big topic for a lot of breast cancer survivors. Do you want to tell a little bit about what you went through, what you're going through?
Oh, sure.
How you managed it?
So yes, like Dr. Sherman said, I was estrogen and progesterone positive, ERPR positive, almost 100% estrogen, which is good and bad. Good meaning there's a lot of therapy and treatment out there for it. Two, it's like you have to really limit that hormone in your body almost to zero. So, of course, my treatment was to get on at the time, because I was premenopausal, to get on tamoxifen for 10 years. So I took that, and I was actually lucky in comparison to what a lot of people I hear out there talk about. I didn't have many side effects. I did have the hot flashes, mood swings here and there, but it wasn't bad in my case. Then research came out probably around late 2017, early 2018 about really suppressing the ovaries, even in my case, being at a young age or younger 40s. And so they suggested I get on Lupron injections, which limits ovary function and any estrogen coming into the body that way. That was a horrible thing for me. I would take it once a month and have mate. I felt like I was someone that wasn't like someone evil living inside my body. I was just really short tempered, I was not good. Like snap at my kids, snap at my husband. So when I realized I would have to stay on this till close to 50, I was like, no way. We're going to take everything out. I went and saw a gynecological oncologist, and we talked about the benefits of removing the ovaries and potentially everything, full hysterectomy. So I did that because I wasn't going to have kids. I didn't any more kids. And because I would have had to stay on tamoxifen or do the Lupron injections for the next 7 years, I said, just take it out. I don't need it. So I did that in 2018 and then went on Arimidex. So it's the post-menopausal type because my body was forced into menopause by doing the hysterectomy. And now I'm on Arimidex. I will say the hot flashes were more intense. The libido is blah, just nothing there. It's definite weight gain. There is some, weight gain. I struggle every day working out and eating right, but nothing changes. So I'm currently dealing with that part of things. But the way I look at it is I'm here. And if that's what I have to do to keep this away and not have a recurrence, I'm going to do it. So I try not to focus on the negative. There is some negative to that. Again, libido is a big one. I mean, in the marriage, and hot flashes, which that's fine. They come and go. So other than that, I don't really have a lot of other side effects, but do hear a lot out there of people who do have that, or even just the ones that I have, and it's causing issues for them in their life. And again, it's an acceptance thing. I have to accept this is the way it is, and cancer, whether it's in your body or not, doesn't go away, doesn't change things. So that's where I am now in the whole survivorship portion. I'll probably have to stay on this probably for another 4 years, she said. So
did you at one point or currently take an antidepressant or in that category to manage some of the effects of the hormone blockers?
Oh, yes, I did. So I'm still taking Effexor, and I don't see a huge difference with the way it's managing side effects. But what it is helping me do is handle the anxiety portion as well. And I will say I started at the lowest dose, and I forget what the milligrams are, but
37.5.
Correct. I was doing that for a while. And then one of my appointments with my oncologist, like I said, my husband comes to every appointment, and she had asked how I was doing. And my husband just looked at me, said, "I'm fine." And he was like, "Do you really want to tell her?" And so she just laughed and she said, "Okay, let's up it a little bit." And I just started crying. I said, "Well, maybe I'm not fine." And so now I'm on the next highest dose, and it's been fine. It really has been fine. So I'm taking that more not for managing symptoms of those things, hot flashes and whatnot, but more for anxiety. I don't find that it helps with the hot flashes that much, to be honest.
Mm-hmm. And I want to point out, it's really important for everybody to understand with breast cancer specifically. Jennifer was diagnosed in August of 2016, and here we are 6.5 years later, and the treatment and preventative treatment and the psychological or social or marital issues or medical issues still go on. And what I hear from other breast cancer clients who have breast cancer is they finish their surgery, their chemotherapy, their radiation, and then they ring the bell and everybody's happy in their life, family and friends. "Oh, yay, you're done." My clients tell me they don't feel happy because they don't feel like they accomplished anything. And they don't know it at that time. But as a lot of my clients have said, breast cancer could be the gift that keeps on giving. And so you have 6.5 years later for Jennifer, and yes, disease free and functional, wonderful. In some ways, her life is better emotionally, but it goes on and on for some of these breast cancer patients. And it would be good for family and friends to know that it's not just over when the main treatment's over.
Yeah, I was curious if there was some of those same themes that were explored in the group that was then run, as far as then sexual side effects and perhaps body image, or even just late effects of the treatment. And those are some, I think, that were kind of just brought up in the conversation. But I was curious if there were other themes or other things that you found particularly salient to the conversations.
For my side, one psychological theme that came up in the group is after treatment, some of the women said that they were having challenges relating to other people. One, because the others in their lives, colleagues or friends, couldn't really understand this ongoing nature of breast cancer treatment and prevention, but also that they had been through this huge trauma physically and emotionally, maybe some other ways, and they felt they couldn't relate to other people, or that other people couldn't relate to them. I think that was a theme. There's and still today in my practice, I have women going back to work. Let's say they took 8 months off or so to get through the chemotherapy, surgery, radiation, reconstruction, or parts of that. And then they are let go from their job. That has happened multiple times to clients. And body image, absolutely, and sexual functioning, not for everybody, but for many women. So, yeah.
Well, Jennifer, I was curious if there's anything that you have found especially helpful to then talk about in the group, or other themes that maybe we haven't touched on. Just curious there.
No, not necessarily, but I will say, like Dr. Sherman mentioned, I forgot about that, and it comes up a lot in my volunteering, but the people understanding what you're going through and relating to people. I know personally I struggled. That was probably another session I was interested in talking to Dr. Sherman about. Was I felt like my circle was becoming very small, and that was all after treatment, because when I was diagnosed and treatment, it was like everybody just rallied and was wanting to help and support and all that stuff. And it was great. But then after, it was like, people just figured I was fine. And,
there's a drop off there, right?
Yeah. And I think that's just a natural response when I look back on it. But what I struggled with personally was I didn't necessarily need the cheerleaders and the stuff like that. it was just a good friend or a good conversation. And I felt like every conversation that I would have was so just not fulfilling to me. It was complaining about packing lunches for your kids or doing something around the house. And I'm like, look, I'm happy to make lunches for my kids. Like, I'm just glad I'm here to do it. I'm still packing their lunch because I tell my kids, I joke around, my husband gets mad because I make the lunches, but I'm like, that's my labor of love. Like, I still look back on those days where I struggled to get out of bed from the surgery or chemo or whatever, and I'd make their lunch just because that made me feel better and made me feel like
accomplishment.
Yeah. Even something so little. I just find that it was harder to have conversation with people. And it was all about the cancer. I was identified as the cancer patient and how am I feeling? The only place I didn't feel like that was work. And I'm so blessed that happened because I still had so much work to do. Like, they let me do as little or as much as I wanted to do, but that's where I could go and escape and never really have to talk about it. Clients didn't know. No one really knew what was going on. Well, people that I worked with, but they wouldn't even really talk about it too much. So I was lucky to have that. But like Dr. Sherman said, a lot of people lose their job or they quit while they're going through treatment. And I don't recommend trying to leave your job. If you can try to do the minimal or do something to keep your mind going, work from home. There's a lot of those options now after COVID. It just really, really helps. And then also, like she was talking about, after active treatment, after radiation, after chemo, surgeries, all that, it's like, what now? There's that question, am I doing everything I should be doing? Where are my appointments? Like, I was going to appointments every week, or in radiation, in my case, every day. And that all drops off. And it's like, man, it's kind of weird. So I had to readjust after that as well. And I find a lot of people do the same thing.
Just adjusting to that structure or that regimen of your time.
Yeah.
And then shifting to finding meaning. I was hearing that with your recommendation just to stay at your work and to stay in doing, something to maybe speak to that role or just that purpose certainly would be ideal. And I'm not sure if it's not always possible. There's going to be other treatments that are going to be more, the word that came to mind was hardcore.
Mm-hmm.
I did want to ask, I was curious if you had a similar experience. And this was just as I was listening to you kind of talk about how it was harder to feel like others were able to understand what you were going through and that your circle was getting smaller. I mean, I remember having similar kind of thought processes, and that I knew what I was doing for my treatment. I knew what I was going through was pretty awful and unpleasant. And I would get to the point where I would have conversations with others and I did not want to talk about myself. I would only want to have it be, like a one-sided conversation. Like, I know about that. Let's talk about you. That's what's going on with you. So I think that was my way of being able to just focus in the conversation and have that shift in the conversation. So it wasn't, I think maybe there was the thought that I would be bumming others out or that it would just be negative in a way. I'm just curious if that was anything that you've had experienced.
Oh, yeah, absolutely. Everybody wanted to ask about me. And the first question was, how are you feeling? Which is fine. That's a normal thing to ask. But I'm like, do we really have to talk about this again? Or do I really have to rehash all of this again? And that was one of the reasons I created, and it was at the advice of a friend of mine, I created like a private page on Facebook during all of this, because just to give updates to people. And I still, from time to time, I'll post on that, just depending on if there's any relevance. But I'm like, didn't you read all this? I just felt like,
aren't you updated?
Yeah. It's just, I didn't really want to talk about that anymore because I didn't want to be it felt like
a broken record or
yeah, or just sharing negativity, because a lot of it wasn't pleasant that I've had to go through. So again, that's where I thought this is why I volunteer and this is why I do this, is because I can talk to other people like me and that are going through similar things. That's where I find some purpose and meaning now that I've had the diagnosis. Because honestly, when I was diagnosed in 2016, I didn't know one person around my age that had it. Since then, I guess because it's just out there, but it feels like it's closing in on me, where there's lots and lots of people this age diagnosed. So, but I didn't have anybody. So I think it's just important to kind of come together for a lot of people, but that's not everybody's cup of tea. I can tell you that there are a lot of people that just want to crawl in a hole and not talk to anybody and say anything. So everybody handles it differently. And that's when I really tell people they need to get in therapy, because you do need to let some of this out and talk through it, what you're feeling.
Yeah, I think in my perspective, it's a little bit of avoidance there of not wanting to face the fact that there's these unwanted experiences or things that we've had to go through that we really didn't want to have. They were just unpleasant, like we were saying.
Mm-hmm. Yeah, I think a lot of people, it's so painful. The natural tendency is to run away from pain and run towards pleasure. So if you're having painful thoughts and feelings about whether they're fearful or sad or whatever, you want to run away from them and thinking, well, I could just forget about it. Let me busy myself and I'm just going to not talk about it. I'm going to do my best to not feel and think. And in my 25 years of doing this work, I have never found that to be effective, because at some point, these issues, these feelings, trauma is going to come out because it's in you. It's inside of you somewhere. And it just never works, the avoidance and suppression of thoughts and feelings. I understand it, why people have that tendency, but it doesn't work.
Yeah, I think I like the analogy of avoidance being like the Chinese finger trap. You know, the more that you struggle with that, the more it's going to then tighten and be that more difficult to then get out of.
Yeah, absolutely. That's a good metaphor.
There's also that one, what you resist persists.
Yep. Absolutely.
Nice little limerick there.
Mm-hmm.
Yeah, not as cool as your Chinese finger trap.
It just becomes bigger and bigger. I mean, feelings just don't disappear. I mean, we all could remember certain feelings, good or bad feelings from childhood, decades ago, but we remember them and we can feel them.
Jennifer, I was curious if you could tell us a little bit about your volunteer work. It sounds like you've been involved with some local cancer programs.
Yeah, so I guess it was a year or so after the diagnosis, I got involved with CanCare, and it's local here in Houston. However, they match volunteers. I mean, clients up with everybody around the states. But I got introduced to CanCare my first day of diagnosis. There was someone in my oncologist's office that was there. She was a 2-time breast cancer survivor. Again, 30 years older than me, or 20 years older than me, maybe. But she'd been through it twice, once in her 40s and then once 10 years later. But it really helped just to have that person, like, while I was in tears in a basket case, at least tell me, you can get through this. There's options and treatment and all of that. So that was big. I mean, I think, my husband will even tell you, like, once she left the room, I was better just talking to someone like that. So it was a big thing for me on day one, because day one was really hard. And so after that, I kept in contact with her, also another volunteer with the program. And I was like, I want to do that. So I went and got trained. And in my head, I think even I talked to Dr. Sherman about this. I wasn't quite sure I was necessarily ready at the time, but I did it. felt like it was time, and I went through the training. And since then, I've had probably 20 clients that we provide emotional one-on-one support for them. So they get matched up based on what they're wanting. So if they want someone similar age, similar diagnosis, kids, treatment, surgeries, all that stuff, they will match them up as close as they can. So I've had the pleasure of having many clients and talking through them from all over, not just Houston. And it has been very, very rewarding. Again, most of the time, even after the initial phone call that we have is thank you so much. And these conversations usually are hour and a half. And it's just a lot of listening, a lot of tears, just meeting them where they are in their journey and helping just emotionally. It's not like I can provide any counseling. I can't provide any medical advice or anything like that, but it's just to listen. And they all say, like I said before, the same thing. It's so nice to talk to someone who's been through this. And then I tell them my story and complications, and they're like, whoa, that's big. I don't want to scare them, but I'm like, look, things can happen and you'll still be fine. You still hopefully conquer that and move on. But so I've been doing a lot of that. My husband also was trained as a caregiver volunteer, and he now sits on their board. So we're very involved with the organization, just giving back, because I felt like, I came through this pretty good and want to help others. And like Dr. Sherman said, I do feel like I'm a better person since everything has happened. And I know it's hard to say and hard to believe, but it really is true. I look at things differently and think about things differently. And some of the things I think about, I wouldn't have thought about before. So it just changes your whole perspective of life. So I want to just share that with others.
Yeah, I really like how you're able to share just how you've been able to change your thought process and get to a place of acceptance of things kind of happening that you don't want to happen, and that things will come up, and that you've been able to work on some coping skills and find ways to give back by then participating in the peer-to-peer support, and and then also being a member of that group therapy that you recommended, and kind of had a maybe part of that brainchild with Dr. Sherman, right?
Pushed. I think she was
yeah. Just strong armed into existence. I like it.
Well, I know 3, 4, even 5 times over months and months. Oh, do it. She really encouraged me to do it for her and for others. So yeah, I probably wouldn't have done it if she didn't ask about 4 or 5 times.
Yeah, I just thought it would be really good. Like I said, I think most people look for support groups. And I've even heard that, they go to these support groups and it's just a larger audience, not as intimate. Mm-hmm. You don't feel like you can share maybe because it's just a larger group. You don't want to outspeak somebody or over them, or it's just a different setting. And with Dr. Sherman there as the facilitator, it was really nice too, because she kept us on track and maybe brought up things or questions that we wouldn't have asked if it was just us alone. So I think that was huge. Definitely like that idea, Dr. Sherman. I don't know if you've done it since then, but I would be interested, honestly, to do it years later, like in the survivorship portion, in those struggles too, because I think those are big. I mean, I don't talk to anyone right now about that except Dr. Sherman and my husband. It's not something that the topic of everyday conversation. So I think that would be great too.
Yeah. So we don't want to leave a negative bent on support groups, because I think support groups can be very helpful. I think the difference between what we did as a group therapy in my office, there are anywhere from 3 to 5 women, I guess, is very different than at least the support groups here in Houston. The breast cancer support group that I've attended or were guest speakers is just that. They would have people come together, of course, have food and be together, but they were mostly educational. And they would bring in speakers on various topics related to cancer, breast cancer, bone health, or exercise, or they bring in an oncologist, talk about the latest treatments. And they were more educational, but supportive. They weren't necessarily focused on or geared towards or eliciting feelings. My experience has been. And so there are, let's say, breast cancer patients and survivors who want to gather together with other breast cancer patients and spouses sometimes and eat and talk and start forming relationships and then listen to an educational speaker. And they may not be ready and vulnerable enough or comfortable enough sharing, kind of like what you said. The group we had was a group therapy, group psychotherapy, where the goal was to address the psychological and emotional and other, psychosocial, spiritual issues and work on and addressing them to improve on those issues. So you and I think a lot of the other women in that group, not all of them though, but most of them, because they've already been in therapy with me, were ready and comfortable to work in that manner. And then the support groups are there for women who want to gather together with other breast cancer patients and survivors and socialize a little bit and then have a speaker at what works for them too.
I just wanted to thank both of you for being open and willing to having this conversation with us. It's always humbling to be able to and hear both of your the perspective and just the amount of passion you have for then talking about this topic.
It's my pleasure. I hope this is helpful to other people and the listeners. I really do. It was a pleasure to be here.
Same here. Thank you.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey. Thank you for listening to the Sick and Good podcast. We'd like to invite you to connect with us on our social media at Instagram and Facebook accounts. We're also happy to share that we have launched the Sick and Good podcast website, sickandgood.com. This website is a place to read our bios, subscribe to the podcast, listen to full episodes, or read full transcripts, and contact us with your questions or comments. We care about your listener experience and would love to hear from you to keep the conversation going on the topics of cancer and wellness.